Well, I started to be interested in heart disease in women in '91. At the time, I was a cardiologist for 3 years already, and it were the patients themselves, the women, who told me, "Why don't you tell me what I have? You do investigations, you don't reveal what my problem is, why don't you tell me?" And at the time, in '91, the first books and papers appeared on the subject. So, in fact, I was forced by the patients to go into the subject because, as usual, I have been educated with cardiac patients all along the male standard. And I had already the impression that if we put women along the male standard, it doesn't fit, because we have made all diagnostics and therapeutics for the disease that men have. So from that time on, I started to read everything, and 10 years later, I started with the first outpatient clinic for women. And 15 years ago, I stopped seeing male patients, also to have a look, why is this one woman, does she have a higher risk than the other one? So during the course of the past 25, 26 years, I came in contact, of course, with a network of international colleagues. I went to conferences. There were a few world conferences on heart disease in women, for instance, in 2000, 2004, 2010. So we're waiting for the next conference, in fact. And of course, there were a lot of papers that women themselves have a low awareness that they have a very high risk for cardiovascular disease. But it's the women have a low awareness, but the doctors too. So if the doctors don't think about it, the women will also not think about the risk they have. So I think at both sides you need education, perhaps in a different way, to raise the awareness, because for more than 10 years, cardiovascular disease in women is worldwide #1 cause of death. So, and if you ask cardiologists, about 20% of cardiologists will know that. And if you ask women, they will say, well, I think breast cancer is my highest risk. So, and this is a kind of education that you need to repeat all the time, because it fades away if you stop talking about it. Because it's a male-dominated field, and for male cardiologists, more technical things are more attractive than talking about female patients.